we're going to talk today about really how Curative is uniquely positioned to meet the needs of the public sector. We know how incredibly important it is to you all to be able to deliver the highest quality of benefits that are affordable for your employees. And there is no one better equipped to bring you all up to speed on Curative's incredible solution other than our founder and CEO, Fred Turner. So Fred, I'm going to turn it over to you.
All right. Thanks, Beth. Excited to be here to share a little more about Curative and how we can cut costs, but actually deliver better benefits as a result. So before we dive in, a little bit of history on Curative as a company, because we're definitely a little unique, but also we have a long background of partnering with the public sector. So Curative was founded in January of 2020, actually initially working on improving sepsis outcomes, but as the COVID-19 pandemic hit, it shut down our partnerships on the sepsis side, and we worked to scale up COVID-19 testing, scaling from about 7 to 7,000 employees in the first 12 months and delivering close to 10% of all US COVID testing across about 46 states, thousands of testing sites, 36 million tests, and about 2 million vaccines. Basically, all of that was in partnership with the public sector, either directly providing tests to them or collaborating on offering tests to the public. So we do know how to deliver healthcare at scale and have a long history of doing so. Now, obviously, COVID was a short-term need, not a long-term need. And so we, even from about the middle of 2020, were focused on what comes next. And we had a unique experience being an employer with 7,000 employees trying to provide great coverage and never really being satisfied with what we could get to cover our employees. Meanwhile, every year we'd get hit with a 30% rate increase, even though things were running well. We'd negotiate, you get down to plus 15. We thought there's got to be a better way to do this. Simultaneously, we were working with basically every large insurance company on the COVID testing and seeing the ways that they try to get people to put off and defer preventative care, and we thought we could do better. So the Curative plan launched in 2022. We've been growing rapidly since then. Last year, we grew about 4x to now about 100,000 covered lives nationally. It's about 730 employer groups, and we already have 60 public sector clients, about 30 school districts, and more than 25 municipalities and counties. We're currently actively selling to groups that are based in Texas, Florida, or Georgia, but we can cover employees wherever they may be in the country. So we have members in all 50 states, as long as a group is headquartered in Texas, Florida, and Georgia. We will soon be launching and expanding into the DC and Maryland markets as well. So let's take a step back and look at the state of public sector healthcare. Obviously, there are a number of real challenges in the public sector healthcare benefits. There's significant legislative impacts, funding challenges with public education funding and the expiration of COVID relief, and then significant retention issues with staffing shortages, high attrition, and the inability to drive pay increases. Healthcare costs become a key driver of retention, and if healthcare is underfunded, obviously a key driver of attrition. So a little statistic at the bottom here, the teacher attrition rate recently hit 13.4%, a record high. We think that one way to fight that is to provide great benefits. So the current state of healthcare, it's complex, it's costly, and it results in people deferring care. So high out-of-pocket costs, such as high deductibles, co-pays, but really any amount of out-of-pocket cost, it makes people feel like they don't have coverage or it's not worth the expense. And that causes people, even for relatively small amounts of money, to kick the can down the road. And what they skip first are the services that you're most interested in getting. Those screenings, the colonoscopies, the mammograms, the things that we know work, that is what people skip when they're presented with a high out-of-pocket cost. We also see significant issues from the complexity. It's so complicated with all the different, this copay on this, but after this coinsurance, but only after you've hit this split deductible. People's eyes just glaze over. They can't follow what's going on. And even if something would have actually been $0 for them, it's so complicated to figure it out that people still put off the care. And there's also minimal guidance. There's nowhere to go. There's nowhere to turn to figure out how to actually access the system in the right way. And so we see what happens is people then defer care and you end up paying for it more in later years when what could have been a preventative visit is now coming back as an expensive high-cost claimant, as an ER visit, as a hospital stay. So 44% of all patients in the US said that they would choose not to receive medical care if their out-of-pocket cost was over $500, even if that would put their health at risk. And this is driving record numbers of people putting off and deferring preventative care. It's 50 to 60% of people that have actually skipped or delayed medical care due to the out-of-pocket cost on a high deductible plan. So more than half of people are actively deferring care. That is going to catch up with us when those people ultimately are not managing their health, they're not engaging in early preventative care. It comes back to bite you as those longer-term downstream costs. So Curative is a fundamentally different model. We're trying to take this on with the Curative plan. It's very simple. All of our members start out the plan year with $0 out of pocket, no copays, no deductibles, no coinsurance for any in-network care. So you can see a PCP, you can have a baby, you can get cancer care, and it will be $0 out of pocket. Now, within that first 120 days, members need to complete what we call the baseline visit. I'll say a lot more about it, but basically it's a 1 hour Zoom call. It's primarily virtual. It's with Curative staff, and it's a mix between an onboarding to the plan and a preventative health visit. And as long as you do that baseline visit, you'll continue to have no out-of-pocket cost for the whole plan year. However, if members don't do the baseline visit, on that 121st day, they will revert back to $1,000 deductible, 20% coinsurance, and a whole bunch of copays. So it's a big financial carrot and stick to say just once a year, we need you to engage in your own preventative health. We need 1 hour of your time. And as long as you do that, everything will be free. If you don't do that, you're going to have a high deductible. Now, we do find that is strongly motivating to most people. We are able to get 98% of our members to engage and complete that baseline visit. For comparison, commercial health plans, if they're getting 10 to 20% engagement on any kind of activity they're trying to do to engage with members, that's considered to be very good. We get 98% of our members to sit down and go through that baseline visit once a year. It is all adult members who must complete it. So if there are adult dependents on the plan, they must do their own baseline visit, and children under 18 will be covered at $0 as long as at least one of their parents has done the baseline visit. So we do find we have to show people the benefits grid, although they don't believe it. You can see here on the left, this is the happy path. If you do your baseline visit and you stay in network, and it is a big, broad national PPO network, I'll share more about that later as well. But as long as you get that baseline visit done, you stay in this column on the left where everything is $0. If you don't do the baseline visit, you're in this middle column here with the $5,000 deductible and the 20% coinsurance. And then our standard PPO plan does have an out-of-network benefit, but it is at a higher deductible. Here you can see the $10,000 out-of-network deductible. Now, we do offer 3 tiers of plan. Sometimes we see that it's important to offer choice. Some people really want to offer choice to their employees, but obviously all of the in-network care is at $0. So what we do is we vary that out-of-network deductible. So you can see we have our EPO plan, the lowest cost option that excludes the out-of-network coverage, the PPO plan at the $10,000 out-of-network deductible, and then we have our PPO Max plan, which is basically the most extreme. If you really want to offer the ultimate in healthcare, that extends the $0 out-of-pocket to the out-of-network as well. So if you do go out-of-network, you may be subject to a balance bill. We cannot protect you out of network from a balance bill, but we will not bill you a deductible or any kind of cost share. It will be $0 cost share, even on the out of network care. All right. So we really tried to build the plan around 3 key things: affordability, engagement, and sustainability. So we want a plan that is affordable both for the employer, but also for the employee. Removing those financial barriers to care is key to getting people to engage early and preventatively with the system. That obviously is all based around the engagement. The member experience starts with the baseline visit, but it continues all through the plan year. That engagement is what allows us to actually keep members healthy and keep the costs down. And that then obviously feeds into sustainability. If we can get people to engage upfront and actually go do those preventative things that we know work, have a PCP, get their screenings, get their cancer tests, we can keep down those costs long-term and manage medical trends down. All right. So this is usually the point where people ask, what is the catch? The catch is you have to do your baseline visit. So I'll say a little more about what that entails. The baseline visit, about a 45-minute to an hour-long Zoom call. It's with Curative staff. So you do it with us. It's obviously completely free. We make them available in English and Spanish with our staff and 210 other languages through a translation service. We have evening and weekend appointments. So we really want everybody to do the baseline. We want to make it as easy as possible. And it's basically split into two halves. So the first 30 minutes, you meet with your care navigator. Everybody on the curative plan is assigned a care navigator. They are like your personal account executive, concierge. They're there for you 24/7. You can text them, call them, email them, and they are there to help guide you through the system. So they can help make an appointment with a provider. They can help with a prior authorization. They can help transferring a prescription. Whatever it is you need, they're there to help. And for that first 30 minutes, they basically onboard you to the plan. So they're going over what is a copay? What is a deductible? Because we find about 20% of people don't actually even know what those words mean. And so you're telling them, hey, you have zero out of pocket, but they didn't understand how it worked to begin with. And so it's not enough just to remove the cost barrier to people seeking care. It's also vitally important to remove the fear of cost. If people fear that it's going to cost them money and they don't understand the plan, then they will still defer seeking care until the absolute last minute because they don't understand that it's actually going to be zero. We'll go over what does in-network mean, how to use the in-network search tool. We look up any current providers they might be seeing, check that they're in-network. If they are, great. Do you need help making any appointments? If they're not, let's get them nominated so you can keep seeing that provider. We'll go over any medications they might be taking, what pharmacy they're filling them at. Are they on formulary? Is a PA required? And so basically by the end of that Care Navigator portion, members truly understand how their benefit works. They know how to use it. And it really kicks off the relationship in a different way where they see us as actively trying to help them get the care that they need. And that really starts to build that trust between us and the member that is so often lost between a health plan. So that's the Care Navigator portion. That is followed by a 30-minute clinical visit. It's with either an MD or a nurse practitioner. And really what they're focused on is gaps in care. So if you're seeing your PCP every year, getting your blood work, everything looks great, they're pretty much going to leave you alone. But what we're looking for is those members that haven't seen a PCP in 5 years or 10 years or sometimes ever. You know, maybe a few years ago, somebody told them that they're pre-diabetic and they took the medication for a little bit, but then, it's costing me $10 a month. I don't want to pay for that. I feel fine. And we see so many people who kind of fall into that bucket where their healthcare strategy is burying their head in the sand. And those are your members that are ultimately going to show up as high-cost claimants if you don't deal with that and help them to manage those chronic conditions. So we can sit down with the clinician and say, look, you're going to have to deal with this. Here's what's going to happen if you don't. And we will get you in with a PCP. It'll be $0 out of pocket. We'll even make the appointment. All you have to do is show up. They're probably going to prescribe you this medication. That will be $0. And by the way, we'll deliver it to your house with the Curative Pharmacy free next to delivery. All you have to do is take it. Now, even with all of that, you still don't ever get everybody. There's always somebody who refuses to do what they need to do no matter what. But it's not about getting everybody. It's about bending that cost curve. And this level of engagement, covering these basics with 98% of our members, really allows us to bend that cost curve and get far more of those people engaged in managing their care and avoid those downstream hospitalizations, ER visits, and specialty drug use that drives up your long-term costs. So we do find members love the baseline visit. We do a net promoter score after, and we score 78 for a health plan. Usually if you're double digits, you're doing incredibly well. Some are even negative. The way the Net Promoter Score works is to get a 78. That means at least 78% of people had to give us a 9 or 10 out of 10. Members really like the experience. They get 30 minutes uninterrupted with a doctor. They actually get to understand how their health plan works, and they come out of it very positive and enjoying the experience. And as I said earlier, we do get 98% of people completing the baseline visit. The $5,000 deductible, if it's not completed, is a strong motivator. But we also do a ton of very active work to reach out to members ahead of the 120 days expiring to make sure that they are aware. We reach out by text, by email, by physical mail, and by phone call. So nobody gets to the end of the 120 days without absolutely knowing that they needed to do their baseline visit. And what we see of the 2% who don't complete it, it's actually a very good predictor of who is currently interviewing at another employer and not planning to be on the plan. So of those 2%, 60% of them have actually left their employer within 3 months. Now, we don't think that we're causing that. We think they were planning to leave already, but it is a strong indicator of who is engaged. And I think it further speaks to the fact that the vast majority of people are going to engage with this, given the $0 out-of-pocket cost that they can maintain if they do. So let's look at a couple of examples of how this is played out. These are based on a true story. Obviously, names and details have been changed, But let's look at George, has not been to a doctor for over 20 years, not aware of any medical problems, but he only uses the ER or urgent care in order to actually get care. He drinks after work every night. And the baseline visit was really a chance to welcome him back to healthcare. As an Austin resident, he actually decided to do it in person. Most of these do end up being virtual. And so the clinician assesses the blood work, diagnoses type 2 diabetes, high cholesterol, and hypertension, and discusses the potential alcohol abuse problems. We recommend a course of action, including lifestyle changes, several medicines, and follow-up visits. The member is sent home with a blood pressure monitor for free and actually decides to continue with his curative clinician for primary care and does check in on a regular basis. In this instance, we were able to connect through the Care Navigator, George, to the type 2 diabetes program that does a close follow-up for A1C and glucose levels. He was connected to Pelago, which is an alcohol and substance use program that we offer, again, for free as part of the curative program, and also to a nutrition program. Again, obviously, we have to remove the actual medical details, but we have seen very substantial improvements in A1C for our members who engage in these programs. I'll share some more of the specific numbers later on in the slides. So looking at kind of a different member profile, Myra, who is more engaged with the traditional healthcare system, gets annual checkups, has always been health conscious, given she has a family history of cancer. So the clinician was able to review the recommended cancer screenings, determine what's been done, and discuss the family history. But also, as part of the baseline visit, we were able to offer Myra the first of its kind multi-cancer early detection test, the Gallery test from a company called Grail. So this is a single blood test that can detect up to 50 different types of cancer at stage 1 or stage 2, compared to the stage 3 or stage 4 that they would usually be found at if you were only diagnosing them by symptoms. Now, if you can find those cancers early, they're usually treatable. A stage 1 or stage 2 cancer is generally treatable, whereas stage 3 or stage 4, you're talking how many months to live. And at that earlier stage, the cost is also substantially lower. So it costs 8 to 10 times less to treat a stage 1 or stage 2 cancer compared to a stage 3 or stage 4. So we are the only plan broadly covering this test. Anybody over the age of 50 can access the Gallery test. We promote it heavily during the baseline visit. We have found at this point 9 stage 1 or stage 2 cancers that would not have been diagnosed for years without this. That's likely 9 lives saved. We think this is a pretty incredible technology. It's really, if health insurance isn't it for covering things like this, then what is it for? We're able to find those cancers early, treat them for much lower cost, and then you're avoiding that $500,000 high cost claimant that is ultimately going to hit the plan in a few years' time. Because the cancer, if it's there at an early stage, it isn't going away. The earlier you can find and treat that, the more you're able to get better outcomes and also avoid that very expensive long-term high cost claimant that's ultimately going to come later if you don't deal with it. So Care Navigator made sure that the PCP was in network, set the member up with the Gallery test, and ensured that her regular colonoscopy was also scheduled. So even if you have members that are engaging in the typical way, there are also things like the Gallery test that we're able to offer during that baseline visit that really allow us to mitigate that long-term cost and drive down long-term medical trend. I see a question in the chat, is Gallery test fully covered? As long as you do your baseline visit, like with all other benefits, is $0 out of pocket. Okay. So we really see the baseline visit working to decrease costs. Here's just a couple of examples of that. We see a 15% increase in PCP utilization compared to a Milliman benchmark. We see a 75% of our members registering and using the virtual telehealth, and about 20% of members engaging with the telehealth. It's about 5 times greater than the average engagement that our telehealth vendor is seeing across their population. And we see this really working for chronic condition management. So I think the key numbers to highlight here are the medication adherence rates, where we see 95% medication adherence for type 2 diabetes, 93% for hypertension. Again, it's not rocket science, but if you don't charge members to take their life-saving medication, it is much easier to get them to take it. And that keeps members out of the emergency room and keeps down your long-term costs. We also see about a 5x increase in the number of our members who are engaged with complex case management compared to an industry benchmark. Now, we don't think this is because our members are 5 times more complex, but what we're able to do through the baseline visit is identify members early who are at risk of becoming high-cost claimants or having expensive hospital admission during the plan year and start working with them before that occurs, rather than the traditional case management approach, which is to wait for the expensive hospitalization to happen and then engage. by which point it's really too late to do anything to actually influence or improve that. We engage much earlier because we're able to identify these members through that baseline visit and actually get ahead of it and prevent that hospitalization. And we see this working well in our outcome data. So this is the curative hospitalization rate, admits per 1,000 members, compared against a Milliman benchmark. So Milliman, a big actuarial consulting firm that puts out these 3 benchmarks for inpatient utilization. They have the poorly managed benchmark, which is the red line. The moderately managed benchmark is the yellow line. That's kind of national average. And green is the well-managed benchmark. And that's sort of an aspirational goal for health plans. But curative is the blue line. We're on average about 30% below the Milliman well-managed benchmark. So our members get hospitalized on average 30% less than even the best managed plan, according to Milliman. And we see the same trend hold in terms of bed days. So they're not spending more time in the hospital. Really, this is, I think, showing the whole model that if we get our members to engage early, we get them to go do those preventative visits, take care of themselves, get the care they need early, you actually avoid a significant portion of the downstream cost associated with preventable and unnecessary hospitalizations, unnecessary high-cost claimants that could have been avoided through that upfront care. So I mentioned earlier, the network is a broad national PPO network. So it's a combination of curative direct contracts that we directly build our own network, and then we wrap that with the First Health network. First Health is a subsidiary of Aetna. So it's a large national PPO network with about 1 million providers. It does have most major health systems in that network. Again, we want people to actually access care early, so we want to make that as easy as possible. And so the network is broad. We want people to be able to access care. We also offer 24/7, 365 virtual care. It is available directly through the Curative member portal. It's white labeled and branded as Curative, so you can log on with your Curative login and immediately talk to a doctor, including pediatricians. And we do see a lot of our members utilize that because it's so easy and quick to just immediately get on with the doctor. Yeah, so as I mentioned, Curative telehealth, we do see very heavy utilization of this, partly because of the promotion during the baseline visit. So we do see obviously, most health plans have some kind of telemedicine urgent care nowadays, but usually it's a separate experience that members have to sign up for, download a separate app, create an account, and log in. And the reality is, in that urgent situation, you're not going to go scramble and look for the teledoc letter and spend 20 minutes making an account and answering their questions. You're just going to head to the emergency room. What we do during the baseline is make sure that people are set up and understand how to access the telehealth so that in that urgent situation, they're coming through us for that triage. And if it's immediately available and they understand how to use it, far more people actually do that ahead of just driving to the emergency room. So we do see really great utilization here. And the key to that, as with everything, is getting the members set up in advance so they understand and they know how to use it before that urgent situation occurs. All right. So as well as the network, again, we really want members to be able to access care as easily as possible. So as well as their member ID card and the full PPO network, we also have a really great program, which we call the Curative Zero Card. So this sits on top of the network and provides an even greater level of access for members. I put my physical Zero Card out here. So basically all of our members get, as well as their member card, they get a Visa credit card. It is issued in their name, but fully funded by us, and it will work at any in-network provider. So it serves a few purposes. One is if the member is ever stuck and struggling to receive care, we obviously a newer plan in the market. Sometimes the front desk at a provider's office may not necessarily be the best trained in the world. And if they should recognize they have a contract with us. If they don't, they should recognize First Health. But if the member is still struggling, everybody knows they take Visa. And so that member can always just say, okay, fine, I'll pay the cash price. You swipe your Zero card and you're done. That means that no matter what, the member is always going to get care. And there's never anything blocking or impeding that member's access to care. And so we can get that member in early and reward them for doing so. The other thing this really allows us to do is to rapidly expand the network. So if somebody nominates a provider, we have a very simple form on our website to do provider nominations. It takes about 30 seconds to fill in, or you can text your care navigator to nominate a provider. We will obviously attempt to contract with that provider, but that can take a long time. Often providers don't have the staff to process contracts with health plans very quickly. Meanwhile, we don't want that member to not get care. So if you submit a nomination request, we will give you an answer within 5 working days of whether you can immediately go and start seeing that provider using your Zero card. We accept about 94% of those nominations. And so when groups are transitioning onto Curative, that means even if the provider is not actually in our network right now, we're not seeing disruption because those members can nominate those providers and just go there with their Zero card and pay the cash price. Where we've seen this be particularly impactful is on the mental health side, where there's obviously a real shortage of mental health providers out there. If a member has already established care with a provider, and a lot of the good providers don't take any insurance, they're cash pay only providers. In order to actually access their benefit on a traditional plan, that member would have to seek and establish new care with an in-network provider that often has a long wait time. We allow that member to keep going to their cash pay only provider and just pay using the Zero card. So we have by far the broadest mental health network of any of the carriers because we include all of those cash pay mental health providers as well through our Zero card program. All right. So there are a large number of other programs that are included as part of the plan. Again, all at $0. So we just recently added Rula for virtual therapy. We have Televero for virtual psychiatry. We talked a little bit about Gallery already, but we also have Noom, which has been a very popular weight loss program. We have Pelago for substance abuse. And then one program that's also been very popular is Costco for hearing aids. So we found our members really like the quality of the Costco hearing aids, but they are only available, obviously, to Costco members. So if you are going to get your hearing aid from Costco, we will actually allow you to pay for your Costco membership on the Zero card, as long as you then get your hearing aid at Costco. And what we found is that the cost of those hearing aids is actually about 1/3 the cost of a typical audiologist. So not only is the member getting a free Costco prescription and they can get their free Costco membership and then get their $1.50 hot dogs for the rest of the plan year, we're actually saving the plan about $3,000 every time on the cost of those hearing aids. All right. So final area to touch on is the pharmacy side. This is another place where we definitely have a unique approach that is really able to drive meaningful plan savings whilst also getting members their drugs at $0 out of pocket. So we have our own custom formulary developed in-house where the way it's set up is that for any condition you might have, there will always be a $0 option. Now, if you have a super rare condition where the only thing available to treat it, $500,000 a year specialty medication, it's going to have a prior auth, you're going to have to meet the criteria. But assuming that you do, that would be $0 out of pocket because we don't think that it's helpful to charge that member $100 a month for their $500,000 a year drug. You're not helping to cover the cost of the drug. All you're doing is encouraging that member to stop taking it, get sick, end up in the hospital, and now you're paying for the hospital and the drug. So that's pretty counterproductive. However, if the member has a condition where there are multiple options available to treat that condition, we will have picked the most cost-effective option, and that will be available at $0. So if there's a brand and a generic or a brand and a biosimilar at lowest cost but medically best option will be available at $0. And the higher cost option, if it provides no extra medical benefit, would be at either a $50 or a $250 copay, or sometimes if the price difference is particularly dramatic, it would be entirely excluded. So I think one key example here would be Humira, which went off patent 2 years ago. There are now 9 biosimilar drugs available. The biosimilars are about $500 a month with no rebate. The brand name drug is $6,500 a month with a $2,000 a month rebate, so $4,500 net for the plan. $4,500 compared to $500 is a very significant difference for what the plan would pay, but other health plans have kept that brand name drug either on formulary at parity or even just sometimes as the preferred because they're getting a slice of that $2,000 rebate. We are actually optimizing for lowest net cost. We're not trying to maximize rebates. If anything, we're trying to minimize rebates to get to that lowest net cost. And so we were one of only 2 health plans in the country that entirely excluded brand name Humira as it went off patent. We had 100% conversion success to the biosimilar drug. Clinically, it's been working great for the members that have transitioned. It is basically exactly the same thing, but it is $4,000 per month cheaper for every member who transitions to it. So we've been able to drive very substantial plan savings through basically just avoiding the waste. There's so much waste on the pharmacy side where people are needlessly getting a more expensive drug, even though cheaper options that do exactly the same thing have been available for years. So we are running at about $62 per member per month drug cost, compared to a Milliman benchmark of $105. And actually, our PBM's book of business has been running at $148 PMPM. So we're coming in, close to a third of where our PBM is running, while still getting members their medication at $0 out of pocket. We offer a wide variety of specialty drugs, your Biktarvy, your Dupixent at $0 out of pocket. And we can still do that whilst keeping the total cost down, again, by avoiding all of that waste that we see on the pharmacy side. So we really want to be a long-term partner. Sustainability is the key. You can see here the curative plan at the very beginning. We do see a little bit of an uptick in medical costs as people basically go and deal with all of the pent-up demand, all of the care that they know that they should have been getting, but have been putting off and deferring. But we get through that pretty quickly. We see it drops off within about 6 months. And then by managing down those hospital costs, the drug costs, and those high-cost claimants, we're able to keep the plan at a much lower level of medical trend compared to a traditional plan over those later years. So we really look at it as a long-term investment. We do routinely offer and look at either 2-year rate guarantees or rate caps. We want to be a long-term partner, so that's certainly something we look at with groups. If you're getting a curative quote, be sure to ask about that. Again, we want to partner for the long term, and we want to have that sustainable, predictable trend so that you're not getting hit with massive rate increases, but actually managing the long-term cost from day one. To show that with some data, now that we have been in the market for a few years, we finally now have some data of groups that have been on the curative plan for a full 2 years and have 2 years of credible claims data. So this is the first cohort that started with us January 1st, 2023. And what we see is that they actually have a negative medical trend. They spent over $100 PMPM less in their second year compared to their first year. And you can see the little bump at the beginning. They have an uptick. There's pent-up demand. There's care they should have been getting that they weren't dealing with. And once that subsides, we see a lower medical cost into that second year because we have managed those conditions. We've proactively managed the health of their members, and we can keep that cost down long-term. So usually people are going to tell you medical trend is a positive number, +8 or +9. But if you go about things the right way, we can actually see a negative medical trend over time. And final point just to make, obviously, we are newer in the market, but we are an AM Best A- rated carrier. We just had our rating affirmed for the 3rd year in a row. So we do have the financial strength and stability to do this. We're here to stay. We're growing fast, and we're excited to partner with you. So with that, I'll take any questions.
Okay, Fred and Stephanie, I don't know if you can activate my video. Hi, everybody. Fred, that was super comprehensive and really helpful. I think I failed to introduce myself. My name is Beth Henry, and I am the Chief Marketing Officer for Curative. And again, we're just really happy that you all were able to join us today, and we're getting some really great questions. So let's just kick it off. Fred, we got a question from Andrea Herr regarding preventive care and the fact that it is paid 100% under just about every plan, even high deductible health plans. So she's thrown off by the presumption that preventative care is too expensive.
Yeah, I think it's the great idea that it will be covered at zero. Unfortunately, everybody has heard a story from a friend or a relative who went in for something that was supposed to be a preventative visit. And then if they find anything, well, now it's diagnostic. And so now you're going to get a bill. And so everybody is sort of put off by that idea that, well, it's only zero under certain circumstances that are complex and hard to really understand and hard to get your head around. And well, maybe I'm going to get a bill. And so that fear factor puts people off seeking care, even if it would have been covered at zero, because members don't understand. They don't read the benefit booklet. They don't understand their plan in detail. It's complex. And so we see people defer care, even if it would really have been zero. That's why we really wanted to build a plan where every single member genuinely understands what is it going to cost me to get care, because it's zero. Doesn't matter what type of care, it doesn't matter what specialty, as long as you do your baseline visit, it's zero. And so you can remove that fear factor because everybody can genuinely understand the plan design.
I think we all have stories of the surprise bills that might come along with a colonoscopy where a polyp is found or something like that. Next question is related to the baseline visit. Are child members required to do the baseline?
So children over the age of 18 must do their own baseline visit. But if they're under the age of 18, they would be on the $0 plan, assuming at least one of their parents has done the baseline visit.
Excellent. Excellent. And what are the funding models associated with Curative's plan?
Yes. So we do either fully insured or level funded business. We do not do self-funded. A big part of that is what we saw during COVID, working with a lot of plans. We truly believe that you have to have skin in the game to deliver. We want to have skin in the game to deliver for you as a client. We have to be motivated to actually save money. If you're hiring somebody to pay claims who isn't motivated to save you money, then at the end of the day, they're going to end up not saving you money. So we think level funded is a really good happy medium where there's skin in the game on both ends, both from us to drive savings and also for the employer. But we do also quote fully insured as well.
Excellent. And then another question on whether or not this plan is available only to the public sector, or is it available more broadly?
No, it's available to any employer with 51 or more eligible employees.
Awesome.
So large group only.
Perfect. I can answer this one, whether or not we'll make these slides available. We will, along with a complete replay of the webinar as well. And then another question, just to repeat, which states our curative plans are available in?
Yes, so as long as the group is headquartered in Texas, Florida, or Georgia, then we can quote that group. It doesn't matter where the employees are. They can be spread. We have groups that are national accounts that are based out of Texas that have employees in all 50 states, but it has to be sited in Texas, Florida, or Georgia.
Perfect. And we also got a question regarding who the PBM is on our plan.
So we use Capital RX, but they're not really acting as a PBM. They're more of a PBA. They basically just pay claims for it. So we have our own formulary. We do our own pharmacy network. We take rebates outside of CapRx. They are not involved in any of the rebates. They really are just more kind of a TPA paying the pharmacy claims. Everything else we do it ourselves. It's the only way to manage down the cost there.
Perfect. And we did get a question regarding the admits per thousand there and why there was an auth per thousand. There was a typo on the legend, which it is definitely admits per thousand, and Curative Experience is running 30% below.
We use auths because it's a leading indicator, because you can see months read out on an auth basis faster than the claim comes in. And so if you're looking at auths, we don't have to build in a factor for claims that we haven't received yet. But we do see, once it all shakes out, the auths and the admits add up in the end, because all inpatient admits go through a concurrent review. So we are receiving an auth or a concurrent review request on every one of the admissions.
Excellent. And then a question regarding the zero card and whether or not it is limited to healthcare expenses only. And I need to be reassured that no one can go out and buy a new TV on the Curative Zero card.
It will deny if you try to spend either non-healthcare or out-of-network. So if you try to use it as a non-nominated out-of-network provider, it will decline. If you try to use it at Chick-fil-A, which is actually our most common denial, I don't know why people think Chick-fil-A is going to be a healthcare expense. It will deny. Similar to kind of an HSA card, we can determine what it is that the member is purchasing and where they're purchasing it from. And there's some clever software in the back end that makes sure that we are not allowing any non-healthcare spend.
Perfect. And the next question is about customization and any special programs for municipalities. And I'm assuming that relates to benefit design.
Yeah, so we quite deliberately don't make customizations to the benefit design. We spend a long time curating and perfecting the plan design. Any tweaks to that make the administration significantly more complicated. So one of the advantages we have is that because everybody is on basically the same 3 plans, it is much more efficient for us to administer that. That makes the member experience really good because all of our team know immediately which plan design people are on. We don't have the complexity of loading thousands of different plan designs, and it also reduces the administrative cost because we don't have thousands of plans to administer. So it's very well curated. If we find something that we think is a positive change, we will make it for everybody. We do routinely bring out improvements and upgrades. We continuously try to improve and evolve the plan based on feedback, but we don't make individual customizations. Now, that said, we will offer transition credits. We can offer wellness credits. That's something that we have seen a lot of public sector groups really utilize well to kind of run their own wellness program by the side of the plan. But obviously, because every single member is getting a care navigator and the very high touch white glove experience of the baseline visit, that mitigates a lot of the need. And really, we can use that engagement to drive the wellness.
And are there any participation requirements, Fred?
Aside from our 51 eligible, it's 25 minimum enrolled. So beyond that, there's no participation requirements. If it's 800 eligible and 25 enrolled, we will still quote it, but it must have a minimum number. So there's no percentage.
All right. Another benefit specific, does the plan work with a pharmacy carve out?
It does not. We do not do pharmacy carve out.
And is an HSA available with the plan?
No. If you have $0 out of pocket, you don't have any need for an HSA. If people are using it as a financial saving mechanism, it's better. If people put money in their 401k and max that out, there are very few employees who are genuinely maxing out their 401k and actually need an HSA in order to accumulate more tax-free savings. So we would just recommend people use their 401k.
Perfect. Another question is about whether or not there is a care management component after a hospital stay.
Yeah, so that was why I talked about the complex case management. We do have a team who work with members kind of in collaboration with their care navigator. So the care navigator is obviously going to be involved in coordinating any kind of episodes of care, making sure the member has what they need and has the follow-up. And then our case management team, which is more clinical, will get involved as well after a hospitalization.
Perfect. We are getting quite a few questions about where to send proposals. So everyone can, if you don't know exactly who your sales representative is in your market, you can send proposals to sales@curative.com. And of course, we will put you in touch with the right individual. And we had a question about whether or not anybody would come out to speak to either your clients or to the rest of the consultants in your office, and the answer to that is an absolute yes.
Yeah. So let us know. We're more than happy to come and present. I personally do plenty of finalist presentations, and the sales team can also be out there and make that happen.
Fantastic. And I think, Fred, we may have exhausted all of the questions, but I'd be remiss. Ryan Jacobs posted a comment in our chat and was basically just saying that, encouraging everybody to take advantage of this plan, that it helps everyone, your clients, your members, their dependents. And the truth is that $1 spent in primary care today will be worth $12 in savings in healthcare costs down the road. And that has been cited in many, many studies. So I think that's a great way to end the conversation today. I hope everyone has found this webinar to be incredibly informative. Fred, thank you as always for going through all of the details and answering all the questions. And I hope everyone has a great rest of your day. Thank you.
Thanks, everyone.